critically ill patients. But all this is still trial. There's no, let's say, this is this drug. You have COVID, this is what you are going to take. So until we get a vaccine that will be preventive, I mean, the whole world is still just lying on a precipice.
Okay, from the reports of earlier victims of COVID-19 that was put online, we saw a report of regular intake of fruits and some medications.
Yes, just to build the immunity. The whole idea is to build the patient's immunity. Like I said, there's some reports that say most patients that have COVID-19, for example, that they are low on vitamin D. Okay. Then of course, we talk about high dose of vitamin C. Usually for the patients that have COVID, we give them as high as 1,000 milligrams of vitamin C on a daily basis. They take 1,000 milligrams, of course, also take that with zinc. So all that is just geared towards building up the patient's immunity so that he's able to fight the virus better. Because I don't know if we talked about it the last time. A lot of people will have this virus and never know they have it. 80% of people will have it and recover from it.
Are there no visible signs?
Yes, for some people, their immune system will just fight it and they won't have any symptoms. So there will be no visible signs. Now, for some people, they will just have it as a slight cough. Oh, I coughed a bit. Oh. You understand? Then for some people, those are the ones that will now progress into the mild, the moderate, and the severe cases. And then out of that, about 1% will probably die. You understand? About 1 to 2% are the ones that will die. So this is how this is a trajectory of COVID. So a lot of people will just have it, but they can spread it to someone that will be ill and probably die, but they will never have any, they might never have any symptom, they might be asymptomatic. And that is why it is important when they say people should wear masks, because the person you are sitting next to may have it, but is asymptomatic. You understand the point of trying to make? So it has a half-life. What do I mean by that? It comes within 5 to 7 to 10 days. It will wear itself out. The body's natural immune system will overcome the virus. That is why that's how it works. So that's why they say between 10 to 14 days. If you stay up to 14 days, you can even go out without testing yourself back. Because initially when we started, we're talking about 2 negative tests. That means by the 14th day, if you've been asymptomatic for up to 48 hours, we go and test you, the PCR test. If you come out negative, we repeat it in 48 hours. The second negative we discharge. And after some time, we now said only 1 negative. And after some time, it further evolved to say you don't even need any test at all. If you've stayed 14 days and you've been asymptomatic for up to 48 hours, you are free to go home without any test. So it's actually an evolving disease as it is. And where we are now is a good place. It's a good place. But let us not overblow ourselves. Let us not overhype ourselves. Let us not rejoice in such a way that it will take us back to where we're coming from. Yeah.
Okay, still on the issue of the preventive measures or the precautionary measures that should be taken, the special focus is on the wearing of the face mask. We've had reports and record of a number of persons constantly wearing the face mask, having difficulty to breathe smoothly.
Yes.
Are there adverse effects with regular and constant use of the face mask?
Well,
and in such situation, what
do they do? Well, maybe because I'm a surgeon, I'm primarily a surgeon, so I'm used to wearing face masks anyway. So it's part of my life. But yeah, those are real fears. But the truth of the matter is that the face shields they wear now don't offer any protection. The face shield will only offer protection if you wear a face mask with it. Now, the preventive measures include the face mask, include the social distancing, include the hand washing, okay? So those include avoiding overcrowded events, particularly indoor events that are overcrowded. If it is outdoor, you still want to avoid the crowd, but it's even better than an indoor with air-conditioned events. So those are the little precautions you can take and put you in a better position than just expose yourself as if everything. We keep on talking about the new normal, But it seems that thing has not sunk to us in Nigeria. There's really no new normal. We are so quick to want to get back to our old ways of life. In fact, we can't wait to get back to the old ways of life.
Okay.
Yeah.
Okay, with the issue of the face mask,
yeah.
What do you do?
Yeah, so you were talking about people that have difficulty in breathing. Then in that case, they have to, as much as possible, stay indoors. For longer periods, yes. Only go out when you really need to go. It's a must, yeah. Those people should try and stay indoors and avoid crowds as much as possible. Because if you stay at home, you don't have to wear a mask if you're alone. Okay. Yes, so you try and avoid crowds and avoid people. Social distance as much as possible. That's what you need to do.
Still on the issue of COVID-19 pandemic, a number of factors or a number of thoughts have actually said a Nigerian environment, Nigerian situation. Climatic environment, talking about the weather. Nigeria did not actually permit or give them enough space to have more confirmed cases. Do we have a theoretical relationship to that, specifically pointing to the climatic condition of our country, Nigeria, not giving rise to the number of confirmed cases?
No. A very simple answer to that is straightforward. We didn't test enough.
Okay.
We were not testing enough. We had few testing centers. We had fewer testing centers. We were waiting for people to come to the centers to test, rather than going out into the community. We didn't go out into the community to test. If we had gone out into the community, particularly when it became it became community-based infection, wow, the numbers would have been alarming. Because the truth of the matter is that I'll tell you the truth, even a lot of deaths that would have happened this period, most likely would have been due to COVID, but they didn't go down as COVID deaths because the patients were not even tested before they died. So the truth of the matter is why our numbers are low is that we are not testing enough.
Okay, this is where we must wrap it up on our segment, A Time with the Doctor this morning. We'd like to say thanks to our doctor that has given us a guide in order to stop the spread of COVID-19. Though the curve has been flattening, we still need to do the needful in order to be healthy and safe. A big thanks to Dr. Neku Okolubu, ENO is a throat surgeon with Delta State University Teaching Hospital. Thank you for being our guest.
Thank you so much.